health sense. For 45 years, the Congressional Black Caucus has been out front in Congress in fighting for these freedoms and protections. And when it comes to the matter of health equity, I have worked to champion the health policy concerns of vulnerable communities as my predecessors in the Congressional Black Caucus Health Brain Trust, the Honorable Louis Stokes and Dr. Christensen, have done. Some of my colleagues here know this, but I want to repeat it for anyone who doesn't. Before he was killed, Martin Luther King was quoted as saying, "Of all the forms of inequality, injustice in health care is the most shocking and inhumane." I couldn't agree more. And as the chair of the Health Brain Trust, I've worked with many of the people in this room to focus on advancing this critical phase of the human right and civil rights struggle, health equity. When Benjamin Franklin created the nation's first public hospital, the Pennsylvania Hospital, he did so in order to establish the promotion of public health as a core American value. He did so to care for our nation's diseased and sick poor. Nearly 300 years later, the Affordable Care Act cemented health care as a fundamental right for all Americans. Yet today, we find ourselves at a crossroads in health care. Health disparities in communities of color continue to be intractable hurdles in the quest to achieve health equity in America. African Americans are infected with HIV at a rate that is 8 times that of white Americans. While white women are more likely to have breast cancer, African American women are 40% more likely to die from the disease. African Americans, Latinos, Asians, and Pacific Islanders, as well as Native Americans, are diagnosed with lupus 2 to 3 times more frequently than Caucasians. More than 13% of African Americans aged 20 or older have diagnosed diabetes. And people of color are 2 to 4 times more likely than whites to reach end-stage renal disease. This grim snapshot illustrates that, despite the gains we've made since the days of Ben Franklin and the ACA, there is still much ground to cover in closing the health equality gap. Last year, I drafted a comprehensive report, the Kelly Report on Health Disparities, an official congressional analysis of the state of minority health in the U.S. that offers a blueprint for reversing negative health trends in communities of color. The Kelly Report brought members of Congress together, medical professionals, and public health thought leaders to examine the root causes and impact of health disparities in America and provide a comprehensive set of legislative and policy recommendations to address them. The whole can only ever be as healthy as its parts. For America to achieve true health equity, lawmakers, community leaders, and industry stakeholders must come together and aggressively work to reduce disparities nationwide. We all have a part to play in creating a healthier America. We must take heed of Dr. King's words. Of all the forms of inequality, injustice in health care is the most shocking and inhumane, and we can